On this week's episode, we're going to be talking about IT band injury and prevention. Hi, I'm Brooke, and today I'm going to be talking to Dr. Mike about IT bands. So, Dr. Mike, what is an IT band?
So the IT band is basically a big stretch of tissue that runs along the lateral side of our hip and our thigh. Muscle sits up at the upper part of our hip, tendon runs all the way down the side of the legs, similar to like what the seam of my pants would be, and attaches towards the underside of our knee.
Okay, so I guess if I were to incur an injury, is that different between runners and lifters? Do they kind of injure them differently?
The injury is usually pretty similar. It's a tendonitis, so it's an overuse problem. So runners can do it just from running too much or too often, or running on an uneven surface like an old country road. They always run on one side of the street, so their body's a little bit angled, puts a little extra stress. Very common in cyclers as well because of the constant repetitive motion of the knees moving, but then also weightlifting too, doing squats, repetitive squats, or possibly not doing them properly can cause some irritation to that hip and to that knee area.
I know, I've incurred an IT band injury before, and it was just my hips weren't exactly as mobile as they should be. So it was a matter of just rolling that out, which I think we're going to talk about later.
Yep.
So how can I tell if I have incurred an IT band injury?
Okay, so typically presents as lateral knee pain. And so somebody gets a little pain on the very outer portion of their knee, and their first thought is, I need to ice that area, I need to stretch that area. Not the case. The actual problem area is up in the hip itself. Another time would be during the course of running, just some pain in the hip or the knee. Squatting, the one leg isn't as mobile in terms of knees going out at the bottom of a squat. It's typically how they'll present.
So it's not necessarily the IT band itself, it's just the joints connected to it that are causing the problem.
Exactly, yeah. So the IT band is it's a big band of tissue and fascia, and so you can't really do much to stretch that tissue area. You need to work at the hip joint itself in order to get more motion, less stress and tension through it.
So what do we have in the office that can kind of help somebody with an IT band issue?
Okay, so first off, we're always going to check in chiropractically. Could be an issue with their pelvis, could be an issue with the hip, the knee joint, the ankle, somewhere upstream or downstream from the trouble area. We also do a lot of Graston, so it's a soft tissue technique that we do to break up scar tissue within the area itself. We'll prescribe exercises sometimes. Massage is a really good effective way to do it, or the cold laser that we have as well.
Graston definitely works. I've had that done before. We showed it last week. It's not exactly the most comfortable treatment, but it works. It's pretty effective.
Absolutely.
Yeah. So next we're going to talk about different ways to kind of help somebody with an IT band injury, physical things that we do in the office, foam rolling. Rainey's Fitbit is up next.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week we're talking about the IT band and IT band injuries. So I'm going to show you 4 different exercises that you can do to help with those. Your IT band is actually located on the side of your leg here, runs from about your hip down towards your knee. And so what we're going to focus on is strengthening the hip and the glutes, because these are the muscles that help control the rotation of your femur or your thigh bone, and also control the position of your pelvis. So this will ensure that the IT band isn't being compressed or pulled away from the hip, which is usually when you feel that pain. All right, so what you're gonna do first is just lay down on your side. You can be up on your elbow, you can lay all the way down if you'd like, but we're gonna have our legs out straight, and I wanna have your hips in a neutral position so that they're not rocking back like this, so straight on top of each other. And you're gonna raise your leg about 45 degrees and then lower it straight down. So up and down, just like that. Slowly, you don't wanna go too fast because you really wanna, it's not as easy as it looks. And then of course you would do it on the other side too. The next one is called clams. So what we're gonna do is now bend your knees to about 90 degrees. Again, keeping your hips stacked on top of each other, not rolling or rotating them back. And what we're gonna do this time is keep the ankles together, and we're gonna open up through the knees and again back down. This one should be slow also. It's, again, not as easy as it looks. All right, and then you'd wanna flip over and do it on the other side again as well. All right, so then the next one, what we're gonna do is a walking bridge. So on your back with your knees bent, you're gonna raise your hips up so that you're in a bridge position, and then you're going to straighten out one leg, rest it back down, and then alternate to the other side. So just keeping your hips up the whole time, and then just alternating like this. If that is too hard, what you can do is just do a regular bridge where you're just raising the hips up and down like that. That would be an easier version of it. All right, so we have one more to do, so I'm gonna stand up here. And with this one, we do this one a lot in the office actually, and we use a band like this, so it's a complete circle. And what you do is you put both legs inside the band, like so. It's gonna be like right around my shins. I'm gonna keep my knees slightly bent, not all the way locked out, but just a little bent. And then I'm just gonna take side steps, one direction. So we're going this way for a few, and then I'm gonna have to go back so that I get on both sides. So you're usually feeling it the most in the leg that's leading. So this way I'm feeling it in my right, this way I'm feeling it in my left. All right. All right, so I would recommend for all of these to do, 10 reps on each side. You wanna make sure that you're doing it on both sides. And then going through and doing it for about 2 sets. It would be important to do this 3 to 4 times a week or as often as you can. It's only gonna help you. And that'll help, help alleviate the pain that you may be feeling. All right, so that's been this week's Fitbit, and we'll see you next time.
So we're back, Dr. Mike, and he's actually going to walk me through a couple exercises that you can do either at the gym or at home if you have the equipment to kind of help someone that has incurred an IT band injury and to kind of prevent an IT band injury from happening.
Yep, so there's 2 different ways to look at IT band injuries, and so I read an article recently that talked about how strengthening the glute muscles is actually more effective than just simply stretching or mobilizing the muscles themselves. And so doing a combination of both foam rolling, stretching, as well as some exercises has been proven to be more effective than just one by itself. And so I'm going to run Brooke through a couple of different exercises to really help isolate those glute muscles, strengthen those muscles up, helps pull some tension off of that IT band itself. And so what we've got Brooke hooked up to at the moment is just simply a resistance band. It's a TheraBand stretch band, and right now we just have it wrapped around the weight stack here. You can wrap it around the post of a bed, something that's gonna be good and sturdy to where you can do these exercises with. And so the first one we're gonna have her do, have you turn and face towards the machine. And so what she's gonna do is, so I've got a chair here for her as well. And so this is basically just to help stabilize her. We don't want her to be bouncing all over the place. We want to keep a good neutral position. And what she's gonna do is just take her leg from the position it's in and just take it straight back behind her. We're gonna do about 15 to 20 reps. Towards the end of the set of 15 to 20, she's gonna start to feel a real good muscle burn in those muscles that we're affecting.
I'm already feeling
Already feeling a good burn, so that's good. All right, so you can go ahead and relax. Next one, we're gonna have her turn and face away from it this way. And so now with this one, same thing, hold on to the chair, keep in a good neutral position with her body. We're gonna have her take her leg and bring it straight out to the side. And same thing, we're looking for about 15 to 20 reps here. And same sort of thing, she'll be feeling burn after just a couple of reps here that she's doing.
Oh yeah.
Pretty good. All right. Next one, we're gonna have you scoot back just a step. Hit the chair back with her. And with this one, last one, she's gonna turn her foot outward at about a 45-degree angle, and we'll have her take her hip and leg back in about that same direction, away from herself, and we're gonna be hitting just another little portion of that muscle itself. So we're hitting basically that muscle in 3 different ranges, straight to the side, straight back, and then out at that angle, hitting all the muscles that surround that hip that connect to that IT band area. All right, you go ahead and relax. Yeah, it's good. All right, go ahead and unhook yourself there.
All right.
All right, so that's the exercise portion of it. The second part of it that we're going to go through is just going to be some mobilization stuff. So we've got a couple of different tools for that. We've got our trusty foam roller on the side, and we also have a lacrosse ball. So foam roller is a little bit more general. It's going to kind of get a little bit more surface area at the time. Lacrosse ball is going to be a little bit more pinpoint. So if you know you have one spot up in that hip that's a little extra tender, a little extra sore that you need to dig on a little bit deeper, this is what we're going to use for us. We'll start off with the foam roller. So she's going to place on the ground. She's going to get onto her affected hip, basically on the side of her body. So if we're going to be working on her right side here, you basically would take a little area and draw from your hip back towards your butt. This kind of area you want to be affecting. And so she can just kind of do some front to back rolling like this. We can have her do some kind of front to back, so kind of oscillate back and forth like that to kind of pin a spot down that's a little extra sore. You want to be spending at least a couple minutes in these positions to really start noticing some effects. Like I said, this is a little bit more general. We're going to go a little bit more specific, so I'll trade you out the cross ball for the foam roller here. Basically same thing. We're going right on the posterior side, the back side of that hip joint, and this is going to be a little extra sore on Brooke today, I'm sure.
Yes.
So same thing, we're going to just kind of keep rolling on those spots to get a little bit deeper. And what she can even do if she wants to increase the amount of pressure she's getting, she can actually take this leg and cross it over on top of this one. Remember how to do that? Yeah, so we'll have her bring that leg up and over. And same thing, we're getting once again a little bit more body weight on it, a little bit more pressure into that area.
This does not feel pleasant, but I will tell you, if you continue to keep doing this, it really...
You'll notice
feel it.
results with
It'll feel
this
so
pretty
good.
quickly. I mean, within just a couple of sessions worth, you start noticing some results. It won't be so much to where it'll be completely resolved at that point in time, but it'll be to where she can start getting back to the activities that she wants to do, running, cycling, exercise, squatting, whatever it may be.
Yeah. So I guess even as your IT band or your hip, your knees start to feel better, you should always keep continuing.
Keep doing this, yeah. It's the adage is, once you have these problems, you're more than likely to have them again. And so if you're prone to getting, lateral knee pain or just that IT band syndrome in general, this is something that has to be a constant thing that you're doing. Not so much every single day or 15 times a day, but at least a few times a week, spending some time in those areas, or on days that you're going to be either doing a long run or some extra squats.
Yeah, I say word of wise for me. Keep doing them.
Keep doing them, exactly.
Yep, definitely. So make sure you head over to wellnesslab.tv. We do have a PDF attachment on foam rolling, different foam rolling exercises than we showed you here to kind of help alleviate that IT band injury. We will see you next week.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.